Greetings. Today we'll discuss insulin resistance, a condition that affects millions of people worldwide, increasing the risk of developing type 2 diabetes and other chronic diseases. Did you know that insulin resistance is prevalent among a significant portion of adults globally, potentially affecting nearly half of some countries' adult populations? This means that almost half of the adult population in certain countries may have this condition, and many of them might not even be aware of it. Insulin resistance is often a silent condition, meaning it doesn't cause noticeable symptoms until it leads to high blood sugar levels or prediabetes. In this video, we will explore what insulin resistance is, its causes, how to diagnose it, and ways to prevent or treat it through lifestyle changes and medications. So, I'm Dr. James Nelson, and we'll uncover all of the facts and myths about this common but often misunderstood condition. Let's get started. Insulin is a hormone that is produced by the pancreas and helps regulate blood sugar levels. Insulin acts like a key that allows glucose, the main source of energy for the cells, to enter the cells from the bloodstream. When the cells have enough glucose, the pancreas stops producing insulin, and the blood sugar levels return to normal. However, in some people, the cells become less responsive to insulin over time. This means that they need more insulin to allow glucose to enter the cells. This condition is called insulin resistance. When this happens, the pancreas tries to compensate by producing more insulin, but eventually it cannot keep up with the demand. As a result, the blood sugar levels remain high, which can damage various organs and tissues in the body. You can think of insulin resistance as a lock and key problem. Imagine that each cell has a lock on its surface that can only be opened by insulin. When insulin attaches to the lock, it opens the door for glucose to enter the cell. However, if the lock becomes rusty or jammed over time, it becomes harder for insulin to open it. This means that more insulin is needed to unlock each cell, but there is not enough insulin available. As a result, glucose stays in the bloodstream instead of entering the cells. Insulin resistance is often a silent condition, meaning that it does not cause any noticeable symptoms until it leads to high blood sugar levels or prediabetes. Prediabetes is a state where the blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes. Prediabetes can progress to type 2 diabetes if left untreated. Some signs that may indicate insulin resistance or prediabetes are a waistline over 40 inches in men and 35 inches in women, blood pressure readings of 130 over 80 or higher, a fasting glucose level over 100 milligrams per deciliter, a fasting triglyceride level over 150 milligrams per deciliter, a HDL cholesterol level under 40 milligrams per deciliter in men and 50 milligrams per deciliter in women, skin tags, patches of dark, velvety skin called acanthosis nigricans. If you have any of these signs, you should consult your doctor and get tested for insulin resistance or prediabetes. The exact causes of insulin resistance are not fully understood, but several factors can contribute to it. These include obesity, especially excess fat around the abdomen, physical inactivity, diet high in carbohydrates, especially refined and processed ones, family history of diabetes, ethnicity. African Americans, Latinos, and Asian Americans are more at risk. Age, it becomes more common after 45. Hormonal disorders like Cushing's syndrome and acromegaly, medications like steroids, antipsychotics, and HIV drugs, sleep problems like sleep apnea, smoking. To diagnose insulin resistance or prediabetes, your doctor will ask you about your medical history, perform a physical exam, and order some blood tests. These tests may include fasting plasma glucose test. This test measures your blood sugar after you have not eaten for at least 8 hours. Oral glucose tolerance test. This test measures your blood sugar before and 2 hours after you drink a sugary solution. Hemoglobin A1C test. This test measures your average blood sugar level for the past 2 to 3 months. Based on these tests, your doctor will determine if you have normal blood sugar levels, prediabetes, or diabetes. The good news is that insulin resistance and prediabetes can be reversed or prevented with lifestyle changes and medications. Now let's explore some practical ways to apply these changes in your daily life. These simple tips can make a significant difference in your overall health. 1. Portion control. One easy solution is to be mindful of your portion sizes. Try using smaller plates to help regulate your food intake. It's a small change that can lead to more stable blood sugar levels. 2. Balanced meals. Opt for balanced meals that include a variety of foods. Think vegetables, fruits, lean proteins, and whole grains. This can help keep your blood sugar in check. Some examples are vegetables, fruits, nuts, seeds, eggs, fish, poultry, lean meat, cheese, yogurt, olive oil, avocado, and dark chocolate. And stay hydrated. Drink plenty of water throughout the day. Proper hydration can positively affect your insulin sensitivity. 3. Regular physical activity. Incorporating physical activity into your daily routine, even if it's just a 30-minute walk 5 or more days a week, can greatly improve your insulin sensitivity. Exercise helps your muscles use glucose more efficiently and reduces the amount of insulin you need. 4. Avoid processed foods. Limit your consumption of highly processed and sugary foods. They can negatively impact insulin resistance. 5. Sleep hygiene. Quality sleep is crucial. Establish good sleep habits to improve insulin sensitivity. You can watch our video called Sleep Hygiene to get your sleep in order and have a healthy sleep routine. 6. Stress management. Manage stress with techniques like deep breathing, meditation, or yoga. Stress can contribute to insulin resistance. 7. Regular monitoring. Don't forget to keep up with your regular checkups with your healthcare provider. This ensures you're on top of your blood sugar levels and overall health. Insulin resistance is a common condition that can lead to serious health problems if left untreated. However, by applying these simple and practical tips to your daily life, you can take charge of your health and effectively manage insulin resistance. You can improve your insulin sensitivity and prevent or delay the onset of type 2 diabetes and its complications. Remember, even small changes can lead to significant improvements. I hope you found it informative and helpful. If you did, I would love to hear from you in the comments section below. Please share your experiences and questions about insulin resistance or prediabetes, and I will try to answer them as soon as possible. You can also share this video with your friends and family who may benefit from this information. Thank you for watching and stay tuned for more health insights. See you next time.